Health, like education and security, is a fundamental need that every responsible government provides for its citizens. The government does this by first investing in education of the young ones who show interest in medical fields. Nigeria has a lot of brains who continue to show capacity, creativity, innovation, and competence in various medical lines. For instance, Nigeria has cardiologists who treat heart diseases, it has nephrologists who treat kidney issues, and oncologists who treat cancer illnesses. But these medical professionals have continued to migrate to foreign countries because our leaders do not prioritize healthcare. In 2023, lawmaker Gani Johnson proposed a bill that would require medical graduates to work for 5 years in Nigeria before obtaining full license to practice.
Notice that there is heavy decline on medical brain drain. From 24,000 to now, as I speak, we have less than 10,000 doctors in Nigeria. So that is alarming. So I now thought to myself that, okay, let us look at our laws, what is happening. I noticed that, look, the vacuum is that immediately after housemanship, we notice that most doctors, because of greener pastures, there is a capital flight from Nigeria abroad to UK, America, and all that. Now, government has invested so much money in training these medical doctors. So, what should we do? Should we fold our arms? So now, I said, okay, maybe to give back to the society, that is to our people, after training you. Yes, we are not saying you cannot go abroad to make your money, but if government has subsidized your tuition, okay, I mean, to the tune of 40 to 150,000, the least we can get from you is that after your housemanship, before you are given full license, before you are given full license, before you are given full license, at least you can give back to the society within a period of 5 years. So after 5 years, you are free to go.
The lawmaker said the medical students were trained by Nigerians and therefore had to give back to society before Jakbare. That's laughable. You are asking them to give back to society, whereas public officials or high-profile individuals have been traveling abroad for what could be termed medical tourism. The immediate past President Muhammadu Buhari and his family spent over 200 days abroad for treatment. When asked to give his opinion on Buhari's medical trips, Dr. Chris Ngige, former Minister of Labour and Employment, shamelessly had this to say.
Mr. President of Nigeria had been going to his doctors for second opinion in the UK for the past 40-something years, because he's now president of Nigeria, you don't want him to go. I, as little as I am, I go abroad for second opinion on my medical condition, even though I don't have any underlying. But I seek second opinion.
But it still brings us to the right.
Yeah, right.
Yeah, it still brings us to the
doctor to give him a second opinion, apart from his personal physician.
Very sad indeed. Some public officials do not know the implication of a political office holder of a country as big as Nigeria to have a treatment in a foreign country. Is it not a shame? If an individual has been traveling abroad for treatment and then he becomes a political office holder, he is obliged to cease having treatment abroad. This is because he has to be a model for others. The people look up to him, his policies and actions, and develop a certain perception of him. The people watch his every move to spot inconsistencies and hypocrisies. That's why a leader always has to cultivate transparency and accountability. Under Buhari's administration, some senators, such as Senator Abaribe, were bold enough to give honest remarks about the president's overseas medication.
presidential spokesman, it make you laugh,
What is a medical tourist? You leave your country to go to get medical attention elsewhere. Who? And that's not your country. So what are you? You're nothing but a medical tourist. So I don't think we should just continue with this banter. I think really it's a crying shame that we have lost so much to the extent that just to do a medical checkup, you have to go all the way to London. Well, that's, like I said before, we just see people who say something and do the exact opposite. People come from outside this country to come and give medical treatment here. I mean, people have been doing kidney transplants, all manners of things, yeah. Which means that we already have facilities in certain local hospitals here that could take all those type of, I would say, medical procedures. And there are too many very, very great Nigerian doctors here who could also do that. But it seems to me that the Commander-in-Chief is fixated on always running to another country, and there's nothing much any of us can do about it, if that's...
Apart from President Buhari, many other high-profile individuals have been to UK, the US, Canada, Saudi Arabia, and the United Arab Emirates for medical treatment. Atiku Abubakar of the PDP, Ayodele Fayose, former governor of Ekiti State, Adamu, former Minister of Education, Senate President Godswill Akpabio, and even our current President Bola Ahmed Tinubu. While Buhari and other officials enjoy medical adventure overseas, the Nigerian Association of Resident Doctors went on multiple strikes at different times. Ironically, some of these politicians who made medical trips abroad, such as former President Umaru Yar'Adua and Joseph Wires, former Senate President, did not make it alive. Now, take a look at what Professor Shede Odenkalo said about these medical trips.
When Joseph Wires was in his prime, he was the most colorful politician in Nigeria. As Senate President, one of the most powerful under President Shagari.
Yes.
And he did achieve that in his 30s. Right? His parties were the place to go to because President Shagari was not particularly a partying person. And Alex Ekweme, the vice president, was not either.
So
he was the person who had convening capability for the social dimensions of power. And when you read the biographies, autobiographies from that era, you see that he was a man willing and dealing. He was a person deciding who to allow in cabinet and who not to allow. And, you know, if you read Emeka Anyaoku's autobiography, for instance, he tells how Emeka Anyaoku was nominated in 1983.
The second term,
as foreign affairs minister. And he was rejected by Senate. First time. Who was the person who rejected him? Joseph Wires. Yes? Now Joseph Wires dies, and his body cannot be returned to Nigeria because his kids are too destitute, and they want Nigerians to return the body of their late father to Nigeria. They want to socialize the costs of burying their father. Right? Now, why do I tell this story? Where did Fidel Castro die? He died in a Cuban hospital. He died in the care of Cuban doctors.
Yes.
Where did Nelson Mandela die?
Right there in South Africa.
In Nigeria, our big people get returned to our country in the cargo hold of foreign airlines. The remains returned to Nigeria in the cargo hold. These are people who have been flying first class all their adult lives, right? They now get returned in the cargo hold of foreign airlines on their final journeys back to the country. Why? Because most of them stole the hospitals in which they could have been looked after in their old age. They stole the schools in which their grandchildren could have gone, to which their grandchildren could have gone.
Yeah.
The roads that could have taken them home to a safe final journey, they also stole. And they stole the future of the children that could have buried them. And so the children have now taken over their villages. They are all exiled from their villages.
What a brilliant point he has made. Our leaders go on medical trips because they fail to provide resources for our hospitals. Today, the Minister of Health, Alia Pat, or whatever, is telling us that over 60% of doctors have traveled abroad for better opportunities. According to him, Western countries grapple with serious shortage of human resources, so are recruiting from developing countries. Let's hear him out.
Of workforce migration is a global phenomenon. It's not only in health, but as you mentioned, education and other sectors. In the context of Nigeria, there is a global workforce shortage. The northern countries, wealthier, face significant shortage of human resources, and they are recruiting from developing countries like Nigeria. In Nigeria, it's acute. I think we have less doctor to population ratio than many countries of our size, including large countries like India. The distribution of the health workforce is a challenge. Many of them live in cities, Abuja, Lagos, and a few other hotspots. And training them is something that needs to happen. And as you recall, when we came under the president's leadership, we expanded the quota of training of health workers, medical.
What a sad situation. The government keeps telling us it has initiated programs to discourage our medical experts from immigrating to foreign countries. But let me tell the government that any program that excludes the increase in salaries, improvement in the conditions of working conditions, purchase of modern medical equipment, construction and renovation of hospitals, and setting up of scholarships for our medical students is just a waste of time. The government should not pay attention to the boxes alone, but more importantly, to the root cause of these poxes. Now, what do I mean by poxes? A pox is a ball-like spot on the skin that contains a yellowish liquid known as pus. Sometimes you can call it pox, P-O-C-K, or blisters. Poxes are symptoms of disease. There are different kinds of poxes. We have cowpox, chickenpox, smallpox, and the current epidemic, mpox, commonly tagged the monkeypox. Now, it is common knowledge that the World Health Organization has declared mpox a global health emergency of international concern and warns countries to be wary to prevent the spread of the pox. But do you know that mpox cannot be spread without something driving it into existence? And what could that be? It is a living organism known as orthopox virus genus. This living organism is the root cause of poxes. And the best way to prevent the spread of this pox is by injecting vaccines into humans. So, alerting public about the pox, practicing physical distancing, subjecting individuals to quarantine, and things like that. All these are just short-term and palliatives. The more long-lasting strategy is to provide vaccines to make people immune to this virus. Now, based on this analogy, the Nigerian healthcare system is suffering from many poxes. The poxes are the 15,000 medical experts who have migrated from Nigeria in the last 5 years. The poxes are the less than 50,000 doctors in the country who can barely attend to over 200 million Nigerians. The poxes are the medical practitioners whose industrial action persists unabatedly. The poxes are the huge mass of government officials who spend days, weeks, months, and years overseas for medical treatment or just a checkup. The poxes are the millions of poor Nigerians, including children who have no access to primary health care. They are abandoned by government to die of malaria, measles, diabetes, stroke, and the rest. To deal with these poxes, there is only one vaccine, and that is to clamp down on corruption, which is the underlying organism causing these poxes. May God bless Nigeria.